Hello, hello, hello. So this is one of the episodes in our series of the failures and the successes of the ANC party or the ANC government in South Africa. Like in this episode, this is one of the success stories. Like we have videos on successes and failures. Like because it's such a big history, I divided it into these two, like, or else it'll be too complicated. I'll make a 3-hour video of like one subject. So I don't want that. I want to cut it up into sizes. I have to so this is the success part of healthcare. Okay, let's dive in. In its commitment to address the inequities inherited from apartheid, the African National Congress, or ANC, made healthcare reform a top priority. Under apartheid, healthcare access was largely segregated and inadequate, with the majority of black South Africans facing limited access to facilities, services, and essential medicines. The ANC recognized that quality healthcare was a fundamental human right and that access to it was essential for building a fair and inclusive society. Through various initiatives, the ANC-led government worked to expand healthcare access, combat major health crises, and improve health outcomes for millions of South Africans. One of the most significant health challenges faced by the ANC was the HIV/AIDS epidemic. South Africa has one of the highest HIV infection rates globally, and during the early years of democracy, the epidemic was rapidly worsening. In the 1990s and early 2000s, HIV/AIDS spread widely among the population, affecting millions and posing a severe threat to public health and economic stability. The epidemic also put immense strain on healthcare resources, making it a national crisis that required urgent action. Although the ANC faced initial criticisms for its response, it later implemented one of the largest and most effective HIV/AIDS treatment programs in the world. So yes, AIDS is pretty synonymous with South Africa. I think at one stage we had the highest level of HIV and AIDS infected patients or people in the country after Zimbabwe. It was hectic. It was like so many people. And it was a big problem because, look, South Africa during apartheid was kind of isolated. So there wasn't too much movement of people and so on. So you had AIDS hitting like the US and Europe in the 80s. It came from the Congo when did it start? Like, was it 1900s, 1930s or something? It came with the railways from the jungles of the Congo to Kinshasa, and from there, just like with sailors, of course, sailors. As sailors, it spread throughout the world, but it mainly started hitting the US and then Europe in the 80s. We didn't really see that in the 80s. We only started late in the 90s, where people realize, okay, we have AIDS and it's massive, and a big problem was healthcare education. So people didn't realize how dangerous it is. A lot of people didn't even know it was a STD. So we didn't have proper education in schools to warn people about AIDS, HIV, which will subsequently then become AIDS, and its dangers, and all of these things alongside patient care, how not to stigmatize patients and victims of the disease. When I was 16, that was 1996, I was one of the first, I believe, I was one of the first, these sociology classes where they teach you about the birds and the bees and these kinds of things. We were amongst the first people to get like a lecture about HIV and AIDS, and it became like a second nature of being South African. Like we all knew or know someone who has AIDS or has died from it. A lady who worked for me died from AIDS, unfortunately. And yeah, we all know someone if you're South African. And yes, it's like, it's like the plague. It's very hectic, it's very traumatic and emotional to see people that you love and people that you endear, or your employees or your friends or your co-workers, get sick and die from it. Like, it was intense. And one of the successes of the ANC was like that they did address the crisis. They did like not as well as they could have. We will look at in the failure video about this again. We will revisit this. But where the sting was, if they did nothing, let me put it this way, if they did nothing, at one stage, 1/4 of the population had HIV, 1/4 or 1 in 5. I'm not sure which one of the two, but you can imagine if they did nothing and this thing just spread, like typically by men, but like, if this thing just spread and like, you would have seen a much higher victim rate. South Africa, we had these things people called AIDS orphans, children who lost both parents to the disease. And that's around. It's like South Africa has a long list of sociological anomalies that few other countries have. And AIDS, I know AIDS is a global disease, but we were up there. We were really up there, in terms of victims. Now, why would some people would say, how dare I say that this is ANC success? As I said, what if they just left it? Secondly, the AIDS has gone down a lot. You no longer hear about it. Okay, the conspiracy theorists will say, oh yeah, but they're not reporting the deaths and so on. And that, okay, constitutionally in South Africa, legally, you may not be discriminated against if you have HIV or AIDS, unless you're a doctor or a nurse or something, and you may infect someone by accident, then of course not. But if you're, I don't know, taxi driver or whatever, you can't be discriminated against. You don't need to disclose your status as well. But we would have known, you could see the graves. It's easy to find graves from that period. And there are no longer those graves, of people dying at the same time. So it is the ANC that brought the epidemic under control. You can't really dispute this. In the early 2000s, the ANC government expanded access to antiretroviral therapy, or ARTs, to life-saving treatment that significantly improves the health and life expectancy of people living with HIV/AIDS. By 2010, South Africa had become a global leader in ART distribution, with millions of people receiving free treatment through the public healthcare system. This large-scale rollout of ART dramatically reduced the mortality rate associated with HIV/AIDS, saved countless lives, and transformed the lives of individuals who could now live with the virus rather than succumb to it. ART access was expanded further under the National Strategic Plan for HIV, TB, and STIs, which aim to curb new infections, improve treatment, and reduce stigma around HIV/AIDS. So yes, by the we have these like fatalities. You can see people with AIDS, you know, like their skin. You can see like a person who's in their 30s will have like lesions and skin sores, you know, super acne from AIDS, coughing all the time. So you could see the people, you know, like now you no longer see it. And it's because by 2000, they started, you know, giving people these ARTs. And yes, we managed to get enough of the medicine, not totally enough, but enough to make a difference in the mortality rate. In addition to ART, the ANC took measures to prevent HIV transmissions, particularly from mother to child. Prevention of mother to child transmission, or PMTCT programs, became a priority, aiming to reduce the risk of infants contracting HIV from their mothers during childbirth or breastfeeding. By providing HIV-positive pregnant women with ART during and educating communities about prevention strategies, the ANC-led healthcare system significantly lowered the rates of mother-to-child transmission. This initiative helped reduce the number of children born with HIV, contributing to healthier families and a brighter future for South African children. The ANC's healthcare reforms extended beyond HIV/AIDS treatment. Recognizing that healthcare access was limited in rural and previously disadvantaged communities, the ANC prioritized primary healthcare expansion to make basic health services available to all South Africans. New clinics and hospitals were built in remote areas, and mobile healthcare units were deployed to reach communities without nearby facilities. By bringing healthcare directly to people in rural and underserved regions, the ANC sought to address historical disparities and ensure that no one was left without access to essential services. So yes, the basic clinics, that's a legacy. You will go to these super small farming communities, rural areas, you know, like, and you will find where there never were any clinics because the government before the ANC couldn't be bothered by building them. There were now these clinics, and although these clinics were, you know, had a limited, like, you know, reach, you know, like, or, you know, limited equipment, limited medication. It's like, you know, a lifesaver when a woman has to get a C-section, for example, or if you accidentally, you know, chop off your hand or whatever, like, you know, in a farming accident, for farming accidents, like these people can save your life and at least prolong your life before you can be moved to a facility that can properly help you. So it's an essential first responder service that they created. One of the major achievements in healthcare infrastructure was the Clinic Upgrading and Building Program, or CUBP, which focused on upgrading existing clinics and constructing new ones in high-need areas. Under these programs, thousands of clinics were either upgraded or established across South Africa, particularly in rural provinces like the Eastern Cape, Limpopo, and KwaZulu-Natal. These facilities provided communities with easier access to primary care, including preventative services like vaccinations, maternal health care, and basic medical treatments. By investing in healthcare infrastructure, the ANC laid the foundation for a more accessible and effective healthcare system. So yes, like vaccinations, that wasn't like always widely available. And well, luckily now it's changing. South Africa is following the global trend of these conspiracy theorists about the dangers of like vaccinations. Yes, I know, like, you know, 1 in 100,000 people can get some weird disease from a vaccination, but you know, what's the odds? You know, it's 1 in 100,000. You know, like, and these, you could see this outcome, like these weird diseases that you get in, South Africa isn't the third world country. People like to say that we are a banana republic or a third world country. It's not true. Go and have a look at the micro and macroeconomic indicators. Like, people don't die from polio, like they don't die from cholera, they don't die from dysentery, they don't die from malaria. Now and then, yes, but it's rare. It's rare. It's like news. It's like major news if it happens. So, we are not used to these kinds of healthcare things. Like, we have the AIDS, but that's been so significantly brought under control. Like condoms, for example. Like, condoms were in the 90s, you couldn't get free condoms, and then in the 2000s they brought in free condoms. It was quite funny. A couple of years ago, the South African president, Cyril Ramaphosa, he was in Parliament. He was in the Parliament, and he introduced the new condoms. What was the flavor? Yeah, he spoke about the flavors. Like, I can't remember the third one, but one was strawberry and the other one was banana. So this is, it caused a lot of giggles and stuff in Parliament, and some people even criticized him, how dare you speak in Parliament about these kinds of things. But these are exactly the kinds of things you need to talk about. Men should wear condoms, period. It's like locking away, a 9mm. It's like, not drinking and driving, not watching TikTok while you're driving. It's the same principle. And bringing out a novel, I guess strawberries and a novel flavor. It's a very old flavor. What would be a novel condom flavor? Blueberry, watermelon, Hindu Kush, I don't know, whatever. But for people who, from no flavor going to a flavor is good. And because especially if it's a free condom, because now men will be more enticed to use this thing. Because someone else would be more inclined to taste the silicone. So, yeah, it's this is a lifesaver. I know it sounds retarded and whatever, but a flavored condom, is the way to go. If we are talking about preventing these horrible STDs. To further support maternal and child health, the ANC introduced free healthcare services for pregnant women and children under 6 years of age in public healthcare facilities. This policy ensured that the cost would not be a barrier to accessing essential health services, reducing maternal mortality rates, and improving early childhood health. The free healthcare initiative became a cornerstone of the ANC's approach to public health, demonstrating the party's commitment to prioritizing vulnerable groups and building a healthier society. The ANC-led government has also taken steps to address the mental health needs of the South African population. Although mental health care was historically overlooked, the ANC has worked to raise awareness and improve services for mental health conditions. The government implemented the Mental Health Care Act of 2002, which emphasized the importance of community-based mental health services and aimed to protect the rights of individuals with mental illnesses. While challenges remain, including stigma and resource limitations, the ANC's focus on mental health care has been an important step in expanding healthcare systems' scope and inclusivity. So it's a global phenomenon, but some places will have it particularly harsh. For example, the far in the Far East, where mental health is just not seen as a health condition. It's just you know, push out your chest, buckle up, you know, be a man, you know, like, don't cry, you know, whatever. But, you know, like prolonged depression, or what they call in medical terms major depression, bipolar syndrome or disease, schizophrenia, these things are very real, and they can cause a lot of damage. Not just to the individual, which can lose his or her life. By the way, the life expectancy of a bipolar man is 56 years old. It can also harm, they can lose their jobs. It can harm their families, so many different things. And then the ANC stepped in, because this was like kind of a holdover from the National Party, which basically was Nazism light, where you have the ubermensch who's not supposed to be mentally sick, where the ANC came and acknowledged that, okay, yeah, we do have these things. And in like some African communities as well, it was seen as like this massive stigma. You're not supposed to be mentally sick. We are, as the community, look after you, and everything will be okay. You're imagining things. You should read more Bible, or you should like go and see a witch doctor, or you should whatever. In many cases, like, the stigma was like really, entrenched. And for the government to bring out free drugs, antidepressants and these kinds of things, was a big step forward, a massive step forward, where it now, and some of these drugs can be expensive, by the way. Your getting back to age, your antiretrovirals, like any medication is freaking expensive. And the ANC has done a lot to make these things, but you can get it for free. You don't need to pay money. You can get it for free. Here they mentioned, you have to pay for it. No, it's for free. Yes, okay, the healthcare system, it's not Europe. Like, there will be huge queues. There's not nice computerized systems and stuff like that. But as I said, this is why we have like migration or like immigration towards South Africa from other African countries, is where we are probably the best on the continent. If you're a South African doctor, please like correct me if I'm wrong. Tell us more about like the quality and the standard of South African healthcare. Since this is a historical video, it will be appropriate if you can comment on, let's say, I'm interested in the dates of 1918, 1919, 2000, and 2010. If you can comment on that, it will be very interesting. In recent years, just one more thing about mental health care. So, like I mentioned in the previous video, a woman with a mental health care condition was overlooked for promotion, and she basically fought it in court, and she won, and she got the promotion. And now, because of judicial jurisprudence, like, this has opened the path for people with mental conditions to have a more free and a more economically free life, which is great. In recent years, the ANC has also taken significant steps toward implementing national health insurance, or the NHI, a proposed health financing system designed to ensure universal healthcare coverage for all South Africans. The NHI aims to address the unequal distribution of healthcare resources by pooling public and private healthcare funds to provide equitable access to quality healthcare. While the NHI is still in the process of being fully implemented, its goal of achieving universal health coverage aligns with the ANC's vision for a society where healthcare is a fundamental right for everyone, regardless of socioeconomic status. So, I don't know a lot about this NHI, the National Healthcare Initiative, but it seems to me like it's a South African version of Obamacare, where like everyone contributes and, to their like capacity, like what money you can make. It'll be like a tax or something. And then you will like have like, yes, rich people have to pay more money. And maybe they won't be able to go on that beautiful vacation to Rio de Janeiro for, winter. But like poor people, for poor people, like, or let's rather say the poorest of the poor, the situation will be improved. Now, the issue, and this has been signed into law. Like, I believe this is already been signed. Although this law may be challenged later in a court, in like, let's say the Constitutional Court, Supreme Court, we call it the Constitutional Court in South Africa, this law may later be challenged. However, it has been, the initial step has been taken. Now, what a lot of people, the concern about the NHI is that because South Africa is such a corrupt and to a certain extent incompetent and inefficient country, that this will be a disaster. Because like a national health, you pay a lot of your money. It's like, you pay a lot of your money, 5-10%, of your income goes for healthcare. And, or at least insurance, if you're a healthy person. And this, this money can either, in a South African situation, it can be stolen, it can be misapplied, it can be used in an ineffective way. Like these three things can happen. Note this, I'm making a difference between misapplied and using it like ineffectively. Like let's say, a misapplication would be, they did it like during COVID, they bought, shame. They bought like in the Eastern Cape province, they bought these motorcycle like pickup truck thingies with a freaking tarpaulin, like a leather thing on the top to like transport COVID patients to the hospital. But these things weren't roadworthy, so you can't use them. Like, so, that's like a misapplication. Inefficiency would be like, let's say, instead of like getting a Windows system for a hospital, which would be the most logical thing, like some idiot decides to get Apple before you get a heart attack. Let me just explain. Look, when you do something, you go for something that can do the job. I know some of you will say Apple is a superior product, but the fact of the matter is much more expensive. So you'll find very few governments who will not, who's not going to save money, try to save money. Like another example of inefficiency would be to get like, let's say a MRI machine from the USA where you could have gotten one from India, which kind of like, even if the Indian one is like, 30%, and I don't know nothing about the MRI machines, like, sorry, this is just a super huge guess, but, if something, I don't believe in perfection. I think it's a waste of time. Like, you need, if something is 70% good enough, then it should be okay. And this is like the fear of NHI, that like the ANC government, well now it's no longer the ANC government. It is a coalition government as of the time of the making of this video. And this is the fear that it will be a huge mess, and that it may be like, break the entire system. It might drive away the the private insurance companies, it might break existing hospitals. So many people on the right of the political spectrum, like righteously, comment that, you know, maybe fix public or optimize rather public healthcare first. You know, make sure there's no inefficiency, no massive misapplication of funds, no incompetence, and no, absolutely no corruption. And if these four things are met, these four, you know, very important things, that sounds so stupid, I'm sorry, like, then you can say, okay, now the groundwork is laid. If we tax, let's say, the top 10% or the, you know, the top 20% of taxpayers, if we tax them an additional 15%, at the very least we know this money is going to hit the mark, because that's what it's about. But all, you know, at least the NHI starts looking at addressing inequality, because this is the main issue. Like inequality, you'll see this would be a central theme through most of the videos about South Africa that I make. It's very difficult to talk about South Africa without mentioning inequality somewhere. You know, like even if you're going to make a video about butter biscuits, you know, like that's your channel's like niche market or whatever, you know, like somewhere there's a possibility, you know, you won't be able to get around inequality. You'll have to say, oh, for those of you who can't afford butter, you can use margarine or you can use sunflower oil or whatever, you know, like you have to address this. It can't be ignored. So this is what the NHI does. This is a lot of people say, oh, the ANC is a neoliberal party. Prove it to me. Prove to me that they are neoliberal. Because I will know of a lot of people, you know, on the right will prove or try to prove that it's like left wing or socialist. The fact of the matter, it's a centrist. It's a centrist party, and probably it's more socialist than, you know, than neoliberal. It's like, that's what it is. Or else it would not have like brought in this like, you know, Obamacare NHI thing. Pure and simple. Like a classic neoliberal state like Chile would not have brought in this like NHI. Chile, by the way, as well, like healthcare has always been stymied by the far right. Like whenever they want to reform it, like far right parties block the reforms. The ANC's healthcare initiatives have transformed the lives of millions of South Africans, particularly those who were marginalized under apartheid. Through policies that promote access to essential medicines, primary care, maternal and child health services, and mental health support, the ANC has worked to create a more inclusive healthcare system. The party's emphasis on public health has been a key component of its broader efforts to address social inequalities and ensure that all South Africans can lead healthy, dignified lives. In conclusion, the ANC's healthcare achievements underscore its dedication to building its just and equitable society. By expanding access to healthcare services, implementing large-scale HIV/AIDS treatment programs, improving maternal and child health, and working towards universal coverage, the ANC has demonstrated its commitment to making healthcare a fundamental right. These efforts reflect the ANC's vision of a healthier, more resilient South Africa where everyone has the opportunity to thrive. So this is the thing what you need to take into consideration as well. Healthcare is a right. Like that's just, you know, international law would probably align with this view. It is a right, and if greater society, like if it doesn't do something to help sick people, the simplest like example would be if there's like a virus or something, everyone will get it, you know, or may get it in any case because it's not been addressed at the root cause, you know, like, and that is automatically done if everyone has access, you know, or there's like so many different things, like crime, for example. Like someone, I've said this before and I'll say it again, like, you know, if you have a sick child and you can't afford the medicine, you may turn to crime. You know, if you can't find a job or any, you know, way to do it, because like, let's say a very sick child may cost you R1,000,000 a year. You know, that's the price of a small house. You know, so people don't carry that around in their wallets. So it's healthcare, you know, like universal healthcare is a way to keep society stable as well. Okay. The ANC's policies on infrastructure development were another major driver of transformation. Many hospitals were built. So, yeah, like in conclusion, basically with healthcare, in the failures video, we will look at like the failures of healthcare, and there are many. But if you compare South Africa to where it was in 1990 and where it is now, it's like incomparable. Like, and if you don't believe me, go to a place like Haiti, go to the DRC. Like, you can even go to some areas of India, you know, and you'll see that South Africa has a superior like healthcare system. And that is a fact. We can, if you're in the medical profession, please drop us some statistics, some more information. And if you were like an ANC official who did any of this implementation, tell us the story. If you're like someone whose life has been saved by, you know, a clinic that's been built in your area that didn't exist before, please let us know. Thank you, and that's all for now. Bye-bye.